Welcome to Facing the Nation with the leader of the opposition.
Of the opposition. It is Friday, September the 23rd, 2021. I am your host, Annette Ferguson, and today we will be discussing, the whole situation regarding COVID-19 here in Guyana, and also looking at the entire management of this pandemic by the People's Progressive Party, Civic. In studio with me this afternoon to guide in today's discussion is no other than Dr. Richard Van West Charles. Dr. Van West Charles is no stranger to many of us. He served as Health Minister along with other portfolios in the then administration of Lyndon Forbes Sampson Burnham under the People's National Congress reform. Thereafter, we know that Dr. Charles was employed with PAHO at the senior level, and I guess he is going to share some of his experiences at the level of PAHO with us. Also, Dr. Charles currently serves as a member of the People's National Congress Reform, and he's also a member of the Central Executive Committee. Dr. Charles was also the former Chief Executive Officer of Guyana Water Inc., or Guyana Water Authority. Many of us would remember it being called then. And we know that he did a fantastic and an awesome job during his tenure at the Guyana Water Inc. Welcome to Facing the Nation, Dr. Charles, and a pleasant Friday afternoon to you.
Thank you very much, Annette. It's good to be here. I look forward to having a good discussion with you on the important matter of COVID.
Exactly. Thank you very much, Dr. Charles, for being here with me today. Viewers, I would also let you know that 10 minutes just before program time, we will open up the lines so that you can call in and share some of your experiences, share what is bothering you with regards to COVID, and you're free to ask the goodly doctor the hardcore questions regarding COVID. But that being said, before we get into the actual discussion, Doctor, on COVID-19, would you like to share with our viewers your experience working at PAHO?
Well, I actually started off as a consultant with PAHO in the late 80s, looking at the information systems, the health information systems for the Eastern Caribbean. And we developed that project and made recommendations to address the health information systems for the Eastern Caribbean, that's just some 13 countries. I later joined PAHO WHO as the program officer responsible for the Eastern Caribbean. The post is now a representative post, in which I had the responsibility of working with other technical professionals in preparing the programs for all 13 countries under PAHO WHO. So it went from Grenada, including Martinique, throughout Grenada, St. Vincent, St. Lucia, Montserrat, Dominica, Antigua, Anguilla, BVI, all of those countries. So I had the responsibility of overseeing all of those. I then moved from there on to Jamaica as the representative for Jamaica, Turks and Caicos and Cayman Islands, and I had the responsibility of overcharge of the office looking at all of the programs and working with bilateral and multilateral agencies at that time, also while I was in Barbados. And then I moved from Jamaica and went to the Commonwealth of the Bahamas, being responsible for the Bahamas and Turks and Caicos again.
Yes.
And then after that, I moved to Washington, where I headed a department which dealt with information and knowledge management. And I had the responsibility for bioethics and research for Latin America and the Caribbean and the North American program. After that, I then took up the post as advisor to the multilateral financial institutions for PAHO before I retired. And then I came back home. I got involved, as you know, after the elections in 2015. I took over GWI. What I would say is that all along in my course of working with PAHO, and even before I joined PAHO, I had the responsibility of looking at water and sanitation. So we dealt with organizational and management, programmatic development in all of these areas, and focusing on health and development, and highlighting all the time the issues of health inequalities, and especially looking at sustainable development in countries. So it's the challenge that we face now with COVID is not new, and it is for this reason, from my own experience, I'm saying that the government is missing the ball to be politically in the left field and not understanding that in order to deal with this problem of COVID, it is not singularly an issue of the health, but it also has a number of other multifactorial issues related to it, impacting on development as a whole in the country. So I think it's a bit childish not to be inclusive in including other actors in the management of the program, because you need different knowledge bases to be able to arrive at a holistic and comprehensive solution to allow the country to move forward and to stabilize the economy.
Thank you very much, Doc, for sharing. So viewers, there you had it. Dr. Van West Charles do have a wealth of experiences serving at the level of PAHO WHO, and then he shared with us his subsequent tenure there at the GWI. And many will agree with me that from the time Dr. Charles had GWI, we would have seen, the massive increases in water supply, not only here on the coast, but we were able to make massive improvements even in the hinterland areas. So kudos to you, Doc, and those who served under you while you had
my staff
GWI.
And the board.
So, yes, and the board. Thank you very much for your service. But Doc, I want to now turn our attention to COVID-19. And you know for a fact that our first case was on March the 11th, 2020. And you know that the then government, the AP and UFC, we were still in government, when we experienced our first case. But we were able to tackle, put systems in place to ensure that the lives of our citizens were well protected. So when we left government, it was 21 deaths. Today, as of last evening, it is 744. What would you say? What has caused this, this increase in the deaths? What is it that the PPP government is not doing as against what the AP and UFC government did?
Well, let me say to you that the cause of the difference that you're seeing in cases and the deaths has to do with the rate of transmission in the country. And the fact that you're seeing the difference, I think it has to do with the process of contact tracing that was going on during the APNU AFC. The contact tracing, to my mind, was a bit more intense.
Yes.
And although the testing had not gone beyond the public facility, and I was in a discussion in trying to see how we can move it beyond the public health laboratories, I think more people were listening to the government and understanding the direction.
Yes.
Now, what you do have now, so I think you had a greater coefficient of trust at that point in time. What we do have now is a high rate of transmission occurring. And we are not testing enough, and we are not doing enough contact tracing in the system. And looking at the other parameters that needs to be addressed. Now, and at the same time, government's actions, because there isn't the understanding, went contra to some of the basic principles. We do know that with COVID, there is a high increase in inequality and an increase in poverty. And in our country, we have, for example, 35% poverty. Now, I will just use GWI as an example, in that immediately when the government came on board, it sought to fire people. And it's not only GWI, it's more than 1,000 people who were put on the breadline.
Yes.
So there you are. You can't say that you haven't increased poverty and you haven't increased inequality by your actions. You have. And then in terms of the management of the program, what we didn't see is looking at the expanse and the rate of transmission that was going on. And so what the government should have been doing, as they saw the exponential increase, they should have been having and intensifying the work. Under APNU AFC, there were regional committees.
Yes.
So we have a sense now that there are no strong regional committees and there are no strong testing sites across. The president just recently said at the UN that there are PCR sites across, but where are these sites? So that as a community we need to know where the sites are.
Yeah.
But in terms of the testing, we cannot have an economic barrier to testing. The testing should be free. It helps people to know their status. It helps people to understand we are providing preventative information, so they will know in the main how to act if they know their status, and they will take care of their health. People who have concerns, obviously they have concerns with respect to the vaccine, but they are concerned about their health.
Yeah.
So the two things are not separate and apart. So what the government has not done is that sought to understand why is there the level of mistrust. And that's why we're saying they need to be more inclusive and they need to be more transparent, and in a democracy to share more information with the general public. So this is what is happening, in that they're talking about variants and assuming that variants are circulating. But we need to be sure.
Yes.
This program has to be an evidence-based program. And then what they created more distrust by the procurement of the vaccines, how the vaccines were procured. Now, if you look at the childhood vaccines, they have always been procured via the multilateral agencies or direct with the countries, never through a third man. And with vaccines, there are certain conditions that must be met with respect to the cold chain, etc. And those are safety issues. Safety issues to ensure that when people are vaccinated, the vaccines are safe, which means their health is protected. So when you go to a procurement system and you are unable to answer the questions that were asked by the opposition with respect to what are the batch numbers, where did these vaccines go, where were they manufactured, were they in fact manufactured in Russia or some other site, we don't know, and where were they shipped to, under what conditions were they shipped. Once they could not answer those questions, the coefficient of mistrust increased. And so people were uncertain. And then it was a vaccine that was not approved by the normal process of approval that we have adhered to for years, since when we started vaccinations in this country, from smallpox coming right up to the childhood vaccines that we have now. That is the approval of WHO and the recommendations of WHO. Because we're a small country, we haven't got the capacity ourselves to make those decisions because we don't manufacture, we don't produce, right? And they're coming from centers where there is a rigorous approval process by WHO to say everything is right and safe.
Yes.
So we have to be guided by the vaccines that are approved by WHO. The government insisted in the procurement of vaccines outside of the normal and went by way of this middleman.
Why?
And no question, they refused to answer the questions asked. And so they cannot be annoyed with people when people are saying, I don't trust. And then at the same time, you have refused to include the parliamentary opposition at least, and other Guyanese with the capability to work to ensure that the program is well balanced, evidence-based, so that our people can have the confidence in the program and reduce the vaccine hesitancy. So here we are on this situation with respect to vaccinations, but it is not only about vaccinations. There are many other things that have got to be met. The public health guidelines, the masking, the social distancing, the cleansing, and that is an important aspect when it comes to schools.
Yes.
Because the schools must be safe. When we were discussing it, we're now seeing young kids getting COVID.
Yeah.
In Aishalton recently in grade 1, grade 3, grade 4, grade 6. Right? And the schools have had to be closed. I do know that before I left GWI, we had conducted, there was a survey that was conducted which included the Ministry of Health, Ministry of Education, the IDB, PAHO, WHO, and UNICEF, and GWI, that looked at the schools across the country. And we found that the schools, and we knew, because when I got into GWI, one of the things I told the staff in each region that they must check the schools to ensure that the water and sanitation, but they couldn't complete all, nor did we have the budget to deal with all. But it is something now that COVID is on us. It's a condition that has to be met.
Yes.
There is no ifs and buts. It's not a luxury. It is a priority, and therefore the conditions of the schools, it's ensuring that there is 24 access to water and sanitation. They've got to assess their classrooms for ventilation. Some classrooms which haven't got enough windows will require filters, right? And you've got to have more people cleaning the classrooms regularly during the day with cleansers, wiping the desks and that type of thing to protect. But also the school system has to change the way it approaches how it teaches. And it has to recognize that it has to be a combination of asynchronous learning in the system. Because if a child in one class comes down then it is important that child is exposed
Exposed,
everyone
yes,
in that
yeah.
class, and therefore those children need to go home in a form of isolation until they are checked properly, etc. But learning shall not cease. And that's why you will see now in a report coming out of UNDP on the assessments for COVID and its impact in Barbados, it is recommending low-cost internet access. Because once the children are in a scenario where a classroom is exposed, and the children have been exposed, well, the learning doesn't cease. So the Ministry of Education needs to be in a prepared state, and the teachers of that school, that the lessons can continue via the internet, so that the children continue to learn. But you've got to be in a level of preparedness to do that. You've got to understand the dynamic of the disease and what is happening. So, because in essence, what we want to do is to prevent the hospitalizations and death in our country. So if we don't, and the other thing that we have to look at, the greatest effect we are seeing, really it's on vulnerable groups and marginalized communities. We have communities, squatting communities. I think the former President Granger had begun to address the issue of the squatting, etc. Those are things where we see the housing density is very, very high. Many people are in one room.
Exactly.
Right? And therefore, that, I think, should be addressed, should be looked at seriously. And what I don't think is happening with the housing policy is really concentrating on the density in the home. Because if you are just saying, I'm giving you the land, and not looking at housing density.
Yes.
So the family of 8 may just have the money to be able to build a 1 or 2 bedroom. That density, the risk increases as the density increases. So government has to have a more flexible approach with the density of housing as a critical factor. And you have seen this approach in the United States, etc., when public housing has come around, that you have to look. And there are other diseases associated with housing.
Yes.
So those are some of the things, but COVID has impacted on development. And so a lot of the other factors associated, and in our case in Guyana in particular, have got to be addressed.
Yeah.
You know, in Latin America and the Caribbean, what the latest Human Development Report speaks to is a high inequality and low growth in the economies. So there are many other issues. Let me stop there to allow you to...
Yes, Doc. Thank you very much for, the wide explanations that you have just shared with us. But, Doc, while the coalition was in government, we heard about the 4 E's. The E's speaks to the issues of engagement, explanation, then you educate before you reinforced. So we were able, through the Ministry of Public Health, to educate, to bring awareness with respect to the whole COVID, because at that time we know that, the developed countries were actually trying to, get the vaccines on the market and all manner of things and so forth, right? But what we have been seeing now is that the government, the People's Progressive Party Civic, under the leadership of Dr. Frank Anthony, they have not been doing much of, utilizing of these 4 E's. And you will agree with me that while we were in government, we had manuals, we had plans You understand me? We left those things in
Well,
place. So why is it that
they
why is it the hesitancy from the government in not looking at what is already there
Well,
and what they can now build on?
Well, the playbook of the PPP is always to throw out the baby with the bathwater. And instead of, you know, the 4 E's require a process.
Exactly.
It requires a process of respect for people's views. It requires a process for understanding people's views and where people are coming from. But what they have resorted to, sadly, and public health embraces the 4 E's, they have resorted to bullyism. And so they are thinking that by singularly pushing the vaccine and forcing you to take the vaccine and locking you up and taking your job away and all of these things, that they are going to improve herd immunity.
Exactly.
But it's a mistake. It has never borne fruit in the approach. People have concerns. There are people who have problems. They have the white coat syndrome. People who are afraid of needles. I stopped a woman just the other day, 2 days ago, and I said, "But are you vaccinated?" She said, "No." I said, "Why?" She said, "I'm fearful of needles." So I said, "I will go with you.
Yes.
Take it easy." But you need to comfort people. You need to reassure people. And people need to be clear in asking the questions. And people need to be empowered how they know that they are getting the right vaccine.
Exactly.
So if people are not empowered, if people are not told that it is your right, and it is that empowerment has to be repetitive, to say your right is to ask the nurse or the physician to show you the vial of the vaccine. You should be able to ask about the refrigeration of the vaccine. Under what conditions was it kept? It is your right. It is a citizen's right to be empowered to ask those questions.
Exactly.
And therefore, if you are not building a democracy, you have no avenue to permit that type of interaction of the 4 E's. And you are not concerned about what happens to the broad range of people in the country. You know? And then the issue comes in is on the factors of class and race in this whole mix.
Yes.
And so we have to say to the government that this is unacceptable. And this is part of the mismanagement, because these are critical factors. Some people may say they're soft factors, but they're not soft factors.
Yes.
These are critical factors in the overall management of the program. Most important, you should be told, look, here you are, you're receiving the vaccine. If you have adverse reactions, this is where you must report. This is where you must go.
Yes.
And there must be no barriers to your reporting. And the country should know, well, look, this is what we're seeing with this vaccine, this is what we're seeing with this vaccine, this is what we're seeing. Number of people who are fully vaccinated, there are a number of breakthroughs. Yes or no, we don't know, but we have to gather the data to do the research. It is important in terms of how they lay out what they are doing.
Yeah.
You know?
Yeah. But Doc, I want to pick your thoughts here, because I am of the opinion, I mean, this is just my way of thinking, right? Is that the government knew for the fact that they were going to, by way of donation, acquire thousands of vaccines from Barbados. I think the first batch was the AstraZeneca. So what the government should have done is that they should have devised a schedule, a plan. So if you know that, well, look, these vaccines are expected in by April of 2021, you should have had like a 3 months table. you know, we share all across the regions to let people know that, well, look, we will establish sites by way of tents for you to go and have like your to have a physical checkup, right? Like a pre-testing of your entire body to determine your pressure level, to determine your sugar level, to determine all the other factors, whether you're suffering from diabetes, whether you're a cancer patient, and all manner of things. What harm that would have done?
No, that there is no harm. It would be an integration of the primary care system into this process. Now, some people may know their what illnesses they suffer from, but in each center, there should normally be what is called a diabetic register for diabetics. So you know who are the diabetics in your community. In the main, most of the diabetics. But you can also make a call for diabetics to come to see you.
Exactly.
And have a session with diabetics on the E side of the engagement with the diabetics, to educate them about the vaccination, provide them with the comfort that the vaccine is safe for diabetics, provide the hypertensives with comfort, and also say to the elderly that you are a priority.
Exactly.
And the elderly within a different communities, we move them first. Because our objective is trying to reduce hospitalization and death. So that approach, and they should have involved the private sector that are in the communities also. And even if you pay them to see these people and to get some sort of record in terms of identifying who may be at risk not to take. And at the same time, as they're seen by a physician, the physician indicates to them, you are okay, you can be vaccinated. So all of these factors will reduce the hesitancy that we are seeing. But because they took a different approach, and so what we are seeing are some other issues in the society occurring along with COVID. As I said to you earlier, COVID has increased inequality. And out of the Human Development Report, it establishes a very robust correlation between inequality and crime. More so than educational levels, more so than income levels, that the inequality is a direct correlation with the crime that you're seeing. And we are seeing a lot of crime. But where the government is not going in the right direction also is their understanding of development. You see, they've got an old paradigm of their understanding in development, of using the GDP. But if they read an Indian economist who is at Harvard, Amartya Sen, they will understand that development is seen as freedom. Right? And it talks about a capacity approach and the different freedoms. And so what they need to move is to get to a state of unfreedoms, with removing these freedoms, these unfreedoms that we have, and liberty of political affiliation and all these things. We have, whether they want to accept it or not, we have a sense of fear in the country. And whether it's real or imagined, it's fear associated by a determination of your ethnicity. And so those are things that, if they are serious, they must address. So when we call for a more inclusive program, it is because of our breadth of understanding of the determinants of the issues of COVID-19. It is not a singular issue of health, because we do know there has been a significant economic impact with respect to COVID. there are job losses, there are problems with trade. Look, they've got to try to deal with the freight charges, because the freight charges increased exponentially.
Yeah.
Problems in tourism. I mean, we are not a major tourist economy, but in the Caribbean, it has impacted significantly. You know, so all of these things. And then what we have had here in Guyana is coupled with COVID. We've had the flooding.
Yes.
And so many of the communities that already are affected by COVID is a double whammy,
Exactly.
which affected the flooding, etc. But we haven't seen any relief. And you look at some of the recommendations coming out with respect to some of the reports done, the assessments done by UNDP in the Eastern Caribbean. They're recognizing that the children from poor communities, there must, which I have said before, that nutrition is one of the considerations in the schools. So there must be school feeding programs, and they have made an assessment in the Eastern Caribbean of $200 Eastern Caribbean dollars per month per child to deal with the feeding of children from poor communities.
Yeah.
So those are some of the things that we have to consider. But it has to be sustainable. It's not a one-off.
Exactly. And Doc, you will agree with me if I'm to push in this particular aspect of things is that we need there should also be psychosocial support. Because with COVID, it has a mental impact
Right.
on
So
people. So there should be, like a tripartite working between the Ministry of Health, the Ministry of Education, and also the Ministry of Human Services.
I think the Ministry of Health, starting with them, they have got to provide more support to the mental health services, because we don't know everything about long COVID, the mental health aspects, right? So we are learning, and every day there are updates at what is happening with some people, but there certainly are manifestations in terms of sequelae of COVID-19. But it's going to be an issue, an occupational health and safety issue. So employers, managers, supervisors in the public and private sector, they've got to have an understanding. They may feel that somebody is malingering.
Yes.
But if a person may have had COVID, then the tiredness, the fatigue syndrome. I was just speaking to somebody yesterday who had COVID, who was in the ICU. They said to me, the person said to me, I still have this breathlessness.
Yes.
I am tired.
Yes.
And so we need to understand the employers, as these people re-engage in the workforce,
Yes.
the employers, the supervisors, the managers must have an understanding of these issues. So how the program is organized, it's not organized in a way that it communicates and it's a multifaceted program. And people may be alienated, and you may be creating more mental health problems for people, and depression and so forth. In some of these cases with the poverty, we have seen, for example, on the gender side, more domestic abuse since COVID.
Yes.
Right? So those are things that they have to understand, the multivariate contribution to this issue.
Doc, I want to get from you with respect to what is happening with regards to the Sputnik V vaccines. We know that the Minister of Health would have reported to this country that you have in excess of 80,000 people who are waiting for their second doses of the Sputnik V. That's one. A few days ago, we heard CDC, they put out an advisory saying that, well, look, they unapproved vaccines, and we know that Sputnik is one of those vaccines that PAHO has not yet approved. That persons who took the Sputnik V, one, they will not be able to probably enter other territories, and it seems as though persons who would have taken the Sputnik V vaccines, they will now have to take additional vaccines that are PAHO WHO approved. So what do you say to this, sir? Because there are many persons out there. Yesterday I met a young lady. She said to me she took the Sputnik V, just the first dose, and she has been waiting 4 months. So I guess she's in the 80,000 figure. So what do you say to that? And then, further, the Minister of Public Health came out saying that, well, look, he will have to seek clarity from CDC and PAHO with regards to the unapproved vaccines, when we know very well that PAHO would have put out there what are the approved vaccines that states should be using to have their populations vaccinated. So your comment on this?
I know Dr. Anthony was trained in Russia, but what was spoken is English, and his mother language is English.
English, exactly.
Now, WHO has established a process for the approval of the vaccines. There are a set of trials, 3 phases, and they have got to go through the rigor of looking at the data that you present,
Yes.
looking at where the vaccine is manufactured, all of these things. And Pfizer had to go through it, Moderna had to go through it, Johnson & Johnson had to go through it, Sinovac had to go through it,
Yes.
Sinopharm, AstraZeneca, they all had to go through the said process to arrive at the approval.
Yes.
So it is nothing ideological against Sputnik. It is nothing unscientific against Sputnik. Because the first alarm with Sputnik emerged from Slovakia,
Yes.
when this Sputnik vaccine should be described, replication incompetent. It cannot be replicating the viruses used in the production of the vaccine. Slovakia raised an alarm that the viruses were indeed replicating. That went back to the manufacturer. Now, Brazil made many visits, and after a long time agreed to have conditionalities with respect to the vaccine. But WHO has been looking at the data, and WHO has made visits to the manufacturing sites in Russia. There has been no comfort, in particular with one of the manufacturing sites.
Okay.
And therefore, they have asked the authorities to go back and look at the situation, provide more data in the trials, from the trials, especially the phase 3 trial, which is a larger group of people, right? And of people which may have subset of people who are having cancer, and so forth. So those are things that the scientists in WHO look at, and the integrity of the data that is being supplied to them by the institute in Russia.
Yes.
The scientists, it's the same scientists have looked at the other vaccines from China, from the AstraZeneca and from the US. So just put it out of your heads that is anything ideological against the Sputnik. Yes, it's a vaccine center that is known, but you have to be compliant with the regulations.
Yes.
And therefore, it is for this reason that today, up until today, WHO does not have the comfort level. We have to be dependent on the analysis conducted by WHO with respect to the vaccines. That is what we have done all along in the past. For what reason are we going to deviate, especially in a situation of a pandemic? We can't. So I think I heard that they're saying that they want to give boosters the third dose, which is nonsense. It is nonsense. And therefore, people must understand and be empowered to know what they want, what they must do to protect their own health. The citizens must now understand what they have to do to protect their health. Because barring you from entering a building and forcing you to take something that is not cleared scientifically,
Yes.
you make a decision, is life or death. So the government needs to back off on this matter and try to be a bit more tolerant in listening to everybody and be a bit more inclusive so we can move as a country and get over the hurdles.
But Doc, why the hesitancy from the government of not being inclusive? Why is it that they have something to hide? What is it that I mean?
It's power. And absolute power. They want absolute power, and absolute power corrupts.
Exactly, and therefore, Doc, I want to drive home this point. When we were handling COVID just before August 2020, the entire Guyana, probably the entire world heard that we were using the APNU AFC government. We were using Oaks as a gateway, to probably remain in power, and that they had a better plan. They said to this nation, one, they had a task force running parallel to the APNU AFC's task force. Mind you, they were invited to have nominees sit on that task force, which they refused. Right? So we expect, like all Guyanese, we expect that when they came into power, that they would have shown us the plan that they had and show us probably the makeup of the parallel task force that they had. But you're not seeing that.
Well, look, I haven't heard them accept and define the situation with COVID as a national security issue. It is a national security issue.
Yeah.
And so, as a national security issue, it means all hands are on deck.
Exactly.
So, they have come with a strong resistance over a word. But these guys, they have some of their supporters, some of their backers are intelligent, and many of their backers are supposed to be embracing on a daily basis democratic principles.
Yes.
So, unless some of their backers are Trumpian, and therefore they don't care about the collective, and they only care about their tribe. So we have to understand as a collective that we have to ensure that we are protected.
Yeah. Doc, because viewers, I'm going to open the line in another 2 minutes, but I want to get this particular point into Doc. Doc, you spoke to the issue of absolute or total control. I have been following what is happening in Jamaica, what is happening in Trinidad and Tobago, what is happening in Barbados, even Grenada. And the approaches that these countries are using or have used is that they were able to engage the opposition. That's one. Two, they were able to engage civil society. Just 3 days ago, Prime Minister Dr. Keith Mitchell in Grenada hosted a press conference. And at that press conference, I saw technical people from the Ministry of Health providing updates with regards to COVID. At that press conference, you had the churches, the Christian, you had the Muslim, and other bodies represented there. You also had, those from the business community giving their input. But here in Guyana, you're not seeing that. So I do agree with you. It's all about absolute and total control
But
from the government.
and what is not understood, it's not an either or of public safety versus reviving the economy.
Exactly.
That if we have public safety, that we can revive the economy. But we have to work together to learn how to coexist with the COVID. And vaccination and adherence to the public health guidelines, these methods, provide us with the menu. But it requires management.
Yes.
It requires the behaviors of our people to be monitored. So we cannot allow people to drop their guard. And there must be equity in the application of the program. Not because I am a contributor to the PPP that I have an easy pass. And we have to really ensure there's accountability. I understand right now people are even buying books.
Yes. Yes.
So that's not safe for us as a people. That is dangerous. So, and I hope we can get people to understand that doesn't help us, that doesn't help them, that doesn't help their families.
Yeah.
So we have to, I make the appeal again to the PPP, that this is a national safety issue. And everybody, all our hands need to be on deck so that Guyana can move
Exactly.
and rise in a way that we want to.
Well said, Doc. Viewers, if you're so inclined, you can call 225-0010 or 225-0008 if you have questions, concerns that you would like Dr. Thomas Charles to answer, you can so do. But while we await your call, I want to now turn to your attention, Doc. The People's National Congress Reform hosted just yesterday a press conference of which you were a part of. And at that press conference, 10 questions were actually laid to the minister via the public outlets. And we also called for the resignation. Is either Frank Anthony step down or step aside, right? So what would you like to say to this call by the People's National Congress Reform?
Well, the call is because our deep concern
Yes.
for the management of this program and its impact on our people as a whole. And I say our people, our Guyanese people,
Yes.
not the members of the PNC. This is about the Guyanese population. And we feel that these are some of the questions, because we have other questions
Yes.
that will give everyone an understanding as to what is going on with the program. And if they cannot answer these questions, he really needs to step aside and give someone else the seat who will have the capacity to run the program in an effective and efficient way. I don't think it's a person who doesn't have the acumen. I don't know what is going on with him.
Yeah.
But something is going on in the organization. Maybe it's in the PPP's organization, that he is not a free man
Yes.
to be guided by the science, and he is being controlled by others who are less informed.
Yes.
So, but be that aside, what is critical is, as a people, we now need, look, only this morning, President Biden was putting forward
Yeah.
the categories of people who should get boosters, etc. But it's guided by the science and the outputs of the research and the work done by CDC and FDA and so forth.
Yes.
You know, and those are things that, yes, we need an understanding, but we have to, they have to got to understand that our circumstance is a peculiar circumstance
Yes.
with respect to a multi-ethnic country, and therefore the different approaches have got to be considered. It's not a dictatorial approach, you know.
All right, thank you very much, Doc. We have like 3 minutes into program time, but before we wrap up though, Doc, I want to pick your brain on the very press statement put out by the People's National Congress Reform. We know who we are dealing with. That is the People's Progressive Party Civic. So if Frank Anthony fails to respond to these 10 questions, what next?
Well, we have to be considering the actions that we will take in terms of the dialogue with the people as a whole. And it means that we have to give directions in terms of the people, what is going on and how they should protect themselves. And what we need to be starting a process of gathering the data,
Yes.
so that we can have a better understanding of what is happening
Okay.
within the health system. You know, you know, when you see nurses and some physicians having queries, this is not peculiar to Guyana,
Yes.
but some of them may have their own experiences. But we need to talk.
Yes.
We need to understand.
Very true.
Some of them may have had reactions to some of the chemicals in the vaccines. But we don't have Pfizer and Moderna here, which has polyethylene glycol, which many people may have an allergic reaction to. You know, I recall, for example, I was, when I worked with Pahud, and these are, you got to understand allergies. I was in a dental chair, and out of the blue, I had an allergy to latex. And I never had an allergy to latex before.
Oh, yes.
So people have their own concerns,
Exactly.
and we have to listen, and we have to speak to them. We have to explain the science,
Yes.
what is going on, and with this thing.
Yes.
So I think this mandatory approach, this dictatorial approach by the government is wrong. It has never been embraced in the way that in public health, and I believe that we can have many people on board to help in the education if the approach was more inclusive.
Yes.
And we can get to our people so that there's a better understanding as to what is to happen.
Dr. Van Miss Charles, thank you for joining me here this afternoon. I think our discussion, your experience, and your knowledge on public health, I think would have helped to clarify many of the misconceptions and many of the concerns regarding the whole COVID situation here in Guyana. But I will now ask you to take 1 minute just to make an appeal to our citizens with regards to vaccination.
Right. Colleagues, fellow Guyanese, without strong human capital, Guyana can't develop. We know vaccination is not new to us as a country. we embrace childhood vaccinations. Granted, this pandemic has presented a different scenario. The research done has led us to a point where we now have vaccines and other approaches which must work together. I want to appeal to you as a physician, as a practicing physician, that it is important that you take one of the WHO approved vaccines. Pfizer, Moderna, Johnson & Johnson, Sinovac, Sinopharm, AstraZeneca. I ask you, I appeal to you for your own protection, especially our elderly in the community. Our children now, there's the Pfizer vaccine which is available to you. The Pfizer vaccine is safe. We know that these approved vaccines provide the health benefits to help us. But understand that in some cases there are one or two effects that are not all good to everybody. But it's a very, very small likelihood that it may have. You may have some slight allergic reaction. But those effects must be reported to the public health system so that if there is a problem, it can be remedied, it can be corrected. But you cannot go wrong in having the vaccine at this point in time. And I ask you, this is important because it comes down to protecting our livelihoods. It comes down to protecting our families. It comes down to protecting our communities. It comes down to protecting our country as a whole. And I appeal to you that you seek the centers. We are going to press for those who are still yet unvaccinated. You should know your status. And even if when you're vaccinated, you have to continue to wear your masks. This is important. And the system has to continue to educate, to share knowledge, to share information, because we are learning more and more about the viruses, and the viruses are mutating. But the less vaccinations we have, the more mutations there will be, and the greater the efficiency in their transmission will result. So we have the Delta emerging now in Latin America, parts of Latin America, is another one which they seem to escape even what has happened with some of the vaccinations. But without improving the vaccination capacity in the country and the take-up by our country with respect to vaccinations, we will not be able to protect ourselves properly as a country. So I make that appeal to you and ask you, please, go out, get vaccinated with the WHO-approved vaccines. I thank you.
Thank you very much, Dr. Richard Van Charles. Viewers, this is all the time we have on for today's edition of Facing the Nation. I do look forward to you joining me next week, Friday, for another program of Facing the Nation with the leader of the opposition. Once again, thank you very much. Do have an enjoyable weekend, and may God richly bless us all. Thank you.
Thank you.
Join us right here on CNS Channel 6 this and every Friday for the program Facing the Nation with the leader of the opposition from 12:30 to 1:30 p.m. right here on CNS Channel 6.